Hello, I'm Abdillahi Hassan. Welcome to Unscripted. This is our show that takes a fresh look at the Somaliland every other week. In our featured stories, reporters, interviewees, we reveal new aspects of Somaliland in each new episode. The program explores social life in the areas of education, health, religion, heritage, and politics. This week, we look into the young people coming up with innovative solutions for fixing problems. Our first report will look into the healthcare industry and get to know Kaafiye mobile clinic. What is it about? Let's find out. And access to comprehensive healthcare is a key requirement for human development. It promotes health, prevents unnecessary suffering and premature death. Those are all requirements for progressive society. This week in Unscripted, our show that explores untold stories about Somaliland. We take a look into an innovative ideas in delivering healthcare services to the public. Access to healthcare in Somaliland faces many challenges, including service availability and quality care. With its sprawling city like Hargeisa and weak government service provision, the private sector has to step up, and to do that in innovative and creative ways. I'm here to see a startup clinic that's trying to do that. It wants to tackle one of the biggest challenges of healthcare service in the country, namely the timely access to service in convenient places. It was recently started by a group of young graduates from different healthcare-related backgrounds.
My name is Mustafa Jamal Qawdan. I am a trained doctor in general medicine at Hargeisa University. Kaafiye Mobile Clinic facilitates the provision of healthcare services to everyone, everywhere in a convenient way. We focus on people that are unable to visit hospitals, vulnerable people, the elderly, and the children who cannot visit doctors.
My name is Nimo Hamoud Ahmed. I studied nutrition for my bachelor's degree and I was in the 2015 class. Then I started my second degree at Edna Adan University and studied pharmacy. I am class 2019. Now I work at the pharmacy of the Kaafiye Mobile Clinic.
My name is Mohammed Abdillahi Khalif. I work in the marketing department of Kaafiye Clinic. Kaafiye Clinic provides various healthcare services to the people all over Hargeisa. Personally, I work in the marketing of Kaafiye Mobile Clinic, such as connecting the clinic with the people who need our services.
Kaafiye provides a mobile healthcare service on demand. People call them from all over Hargeisa, and the doctor and his team get into their car and head to wherever their patient is. Their hours are long and their geographical coverage is big. They see the patient in his home, office, or any place that he is in, take tests, make a diagnosis, and prescribe treatment.
Our team consists of a doctor, a nurse, a pharmacist, and a man at the call center who handles incoming calls. When we receive a call, we ask them their addresses. We prepare the needed medication and tests and go to the patient's place. We also provide health advice since it's very important.
The team tells me that their motivation is to provide access to healthcare for the most vulnerable people. They target the elderly and provide emergency services in odd hours.
The healthcare professionals came up with this idea. We came together in a group of friends. After realizing the need of healthcare services that is accessible to everyone, many people cannot go to the doctor. Many others cannot access the healthcare services. So we were obligated to assist the society and provide comprehensive services.
The clinic handles a long list of medical situations and clinical treatments, from blood tests to complete physical checkups and even simple surgeries such as circumcision. They market in the social media and other media extensively to raise awareness of their services and health issues in general. For instance, they emphasize on preventive medicine, by raising awareness on the communicable diseases.
One of the activities we undertake is to convince the owners of restaurants to make their staff take medical checkups to prevent communicable diseases. We also visit schools and tell them that their students are vulnerable to communicable diseases such as hepatitis B. We also raise the awareness of the public to take regular health checkups, such as to check their liver and kidney.
In the short term, the team target is to cover Hargeisa city, but their goals are more ambitious in the long run. Their reputation even seems to proceed them very fast. They told me about calls they have received from as far as Las Anod in Somaliland's east. It hurts them to turn patients away, but they are sure someday they will be able to reach them.
In fact, Kaafiye target is to cover all Somali regions in future. Personally, I hope to take the group further, since it was just founded this year. I hope we reach a point that we can provide a service to a patient at his place, instead of people going through the hassle such as queuing up, so that every person can get a regular and reliable health care at his place, whether home or office. So our vision is to bring out a health society.
I asked Dr. Mustafa about how a mobile clinic can be of help in providing universal health care to the wider population, specifically to the people in remote areas. He tells me it is their objective to fill that role and believes that mobile healthcare service is necessary to the country.
Mobile clinics can have a very big role in ensuring wider access to healthcare. Since it is a must that every person gets access to healthcare services, many people cannot get to a doctor, and they need to receive the same treatment as those people living in towns. The universal access to healthcare is a must for Somaliland, and that is our goal and our vision.
All creative ideas to provide healthcare services are in great demand in Somaliland. In this juncture of its history, with so many people in the country needing medical services and limited resources, all innovations are welcome. As the saying goes, the need is the mother of innovation. This brings us to the end of our solution-focused program this week. You can watch the program again on our social media accounts, in YouTube and Facebook at CBA TV English.